Welcome Patho students to week 2. We're off to a little bit of a rocky start. Week 1 was our techno week, and I have students running the entire gamut from totally into the point, totally into Canvas, have completed all 3 extra credit assignments to some students who haven't even signed on to Canvas. So we're going to restart for week 2, and I've actually edited the instructions on Canvas on 2 of those assignments, the ones involved with the practice exam, which is found on the point. That is under assignments, and that is an exam that was created by me to get you familiar with finding your pathway to where the weekly quizzes will be posted and your course exams will be posted, and that is under Prep U assignments. So if you just want to go back and reread those directions, I've also extended the deadline for all 3 of these extra credit activities by 1 week. So don't panic if you haven't found your way there, or if you keep bumping into brick walls because you're doing the same thing over and over again. Poor tech support, I'm on a first name basis with many of them. They've been getting calls about the case studies, for instance. And yes, it's true, there are interactive case studies on the point. However, the course case studies are found in Canvas, as I said in the intro video. So there's an example of maybe people not catching things the first time, or maybe not watching the video in its entirety. But the case studies that are worth course points are actually found on Canvas. You click to open them. They're in your weekly modules, and there is a text box there that you complete and then submit right there on Canvas. So you do have that practice case study, again found on Canvas during week 1 techno week, that is worth 1 extra credit point. So I've extended the deadline for that. And then the other exam that was supposed to be a self-assessment, an exam that you created, it appears that when I was in Internet Explorer and I clicked on Student View, I was still seeing instructor-only material. So I did misguide you in those directions. So if I'm in Foxfire or Mozilla, when I click on Student View, it goes to a true Student View. So I've again edited those directions on how to do that practice exam. And then, you know, the other problem is I called them both practice exams. So I can see that was a source of confusion as well. But in the Prep U tab, there is another feature that you can click on called Practice Quizzes. That's practice quizzes for you. You open up practice quizzes and you'll get chapter numbers for the entire Porth text. So for this extra credit assignment, I wanted you to choose week 3, and then in this case, you go down to the bottom of the screen and you'll choose 5, 10, 15, however many questions. Go ahead and choose 10 questions. Do those 10 questions and then submit. Remember that you're getting credit for doing the assignment, not necessarily your score for that week, the extra credit. From now on, starting week 2, you will get course credit for your weekly exams that I post for you based on your performance on those weekly exams. So after that's said, we're going to hit the restart button on some of those techno issues, and I've extended the deadline for those. So, but you should be familiar with the point by now. You should be familiar with your ebook. I think pretty much anybody who wants to see the instructor highlights now are seeing them. If you need a refresher on that, go back to the announcements where there's a link to click on in order to turn on your power to see the instructor highlights. So let's get into actual content for week 2. This is where we're supposed to be all ready to now start reading and learning some of this content. Chapters 1 through 7. Don't fear. if you look at my instructor highlights and if you listen to this video, I'm going to give you an overview of what I want you to pull out of it. And I have identified week 2 as a high volume week. I talked about that last week. Week 4 I call high volume, as well as week 10 high volume. However, that's all you need to do. There are no other assignments for you to turn in during week 2. Is just do this reading and then take the quiz. The quiz that I'm putting up for you, it's 10 points, and you'll find it under assignments, and it does close at the end of the week, which is Sunday evening at 10 p.m., next Sunday evening. So in chapter 1, which is cell structure and function, I would like you to particularly focus on the cell membrane. All the other is very nice, the organelles, the cytoplasm, etc. But remember I said I'm going to instill a focus on what nurses need to know, both related to pharmacology, actual disorders. So it is the cell membrane or the cell wall that I want you to particularly focus on. There is a figure 1-2. I think that figure is extremely complex. So you can look at that and say, I agree, it's complex. But the functions of proteins, lipids, and carbohydrates related to the cell membrane, please read about that because we will be hitting on the cell membrane throughout this course and some of the functions of the cell membrane. You can skip over quite a bit and then go down to compare the processes involved in aerobic versus anaerobic metabolism. And the example that they use in this chapter for anaerobic is glycolysis, which is important for diabetic patients. Glycolysis, that's their example of anaerobic metabolism, and there are others. And then you can skip over very much more, actually the entire rest of chapter 1. So let's move on to chapter 2. Chapter 2 has to do with cellular responses to stress, injury, and aging. I want you to look at all of the glossary terms in chapter 2, and then we'll focus on changes in cell structure. That has to do with stress. How does the cell respond to stress? How does stress cause the cell structure to change? There is something to click on here which looks like it might be very interesting, and you're going to see this in many of the chapters. I'm not sure how it finds its way into all of these chapters, but I'm telling you, in this chapter, it's entitled Altered Cellular Function, which is just what I'm talking about. Let's take a look at that. Is that a video? No, it's 49 slides, and it repeats itself throughout this text. So I'm saying avoid it. So whenever you click on a title that you think might be a video or something very interesting, and you see it's one of 49 slides, chances are you can overlook that. I think that's really a synopsis of this entire course in those 49 slides. But for this chapter 2, I want you to focus on the definitions of atrophy, hypertrophy. These are all things that are in your glossary as well. Hyperplasia, metaplasia, and dysplasia, because all of those will come again later and we'll need to refer to that basic knowledge. Differentiate the causes and the mechanisms of cellular injury. Cellular injury that is physical, due to physical injury, due to radiation injury, chemical, biologic, and nutritional as all causes of cellular injury. Differentiate between hypoxia and ischemia. What are the causes and how does the cell react to hypoxia? And then what causes it to become ischemic. We know that the pathway then from ischemia is often necrosis, leading to cellular death. So I'd like you to differentiate between reversible and irreversible cellular death. There are terms, more terms coming up. I don't think these were in the glossary. One is apoptosis, and necrosis. Apoptosis is really the definition of programmed death, that all cells will die eventually. Necrosis can be caused by some of these external factors as well. So you need to understand which is programmed death and which is possibly premature death caused by some of these other influences. In chapter 3, we're moving right along. This is my big money chapter. This is where you should put, chapter 3 and chapter 7 are probably the most content heavy as far as importance of this whole unit called cellular and tissue function. Chapter 3, inflammation, the inflammatory process, and fever. What is the purpose of inflammation? Differentiate between acute and chronic inflammation. Do go over your white blood cells, which play an important part, and I'll tell you a little mnemonic that we use in the nursing program, and the mnemonic is never let monkeys eat bananas, with each letter standing for one of the 5 types of white blood cells. So never is neutrophils, L is lymphocytes, M is monocytes, which mature into macrophages, E is eosinophils, and B is basophils. And that's a nice mnemonic, never let monkeys eat bananas, to recall the names of your white blood cells as well as the order that they appear, meaning that the majority of your white blood cells are neutrophils. About 70% of your white blood cells are neutrophils, going all the way down to basophils. Depending on what your system is reacting to, your basophils could be measuring between 0 and 3% of your white blood cells. I'd like you to know the 5 cardinal signs of acute inflammation. There are some sophisticated names in here: Ruber, tumor, Keller, Doller, and Functiolasa. But what that really means is redness, swelling, heat, pain, and loss of function. Redness, swelling, heat, pain, and loss of function. The cardinal signs of the acute inflammatory process. So this chapter is going to take us through that inflammatory process, and we're going to see how we have various mediations that occur along that inflammatory process. So I would like you to read about the cell-derived mediators, that is histamine and serotonin, and also the platelet activating factors in the inflammatory process. What are the factors that cause our platelets to get busy during the inflammatory process? And again, I think I mentioned to be able to differentiate between acute and chronic inflammatory process. Also between a local inflammation and a systemic inflammation. You may not realize it, but systemic inflammation often progresses into sepsis. So our ability to recognize that and know what's actually happening at the molecular level or the cellular level, it's very important for us to intervene early in order to provide our patients with their best chance of survival. In this section, I'd like you to read about the acute phase response, the white blood cell response, and fever. What is the role of fever? What is the purpose of fever? And this does, I mentioned earlier that I'm not going to focus on pediatrics, but this chapter, this section in particular, does differentiate the purpose of fever in adults versus the purpose of fever in children. So I would like you to read up on that. Moving on, chapter 4. Chapter 4 has to do with cell proliferation and tissue regeneration and repair. Really, chapter 4 represents the backside of the inflammatory process. So chapter 3 lays out what's going on during the inflammatory process. And then chapter 4 talks about the actual function in tissue repair. How does the tissue survive the inflammatory process, and how does it repair? So here, do read about cell proliferation and cell differentiation as part of that repair process. Moving through the chapter, I'd like you to focus on the important properties of stem cells. So in general, we say stem cells are those cells that are undifferentiated. Stem cells at the bone marrow level haven't received their assignments yet. Are they going to turn into red blood cells or white blood cells or platelets or any one of these other kinds of mediators? So do read about the important properties of stem cells. Moving on through the chapter, healing by connective tissue repair. How does that healing process go? So this is going to be when there's actually been an insult, an assault, or surgery perhaps to the skin, where connective tissue needs to repair. So here we have the topics of scar formation, fibrosis, organization, it's called, a process that I'd like you to read about, as well as adhesions. This is part of connective tissue repair. Another kind of repair we have is called cutaneous wound healing. And there is a video that I would like you to watch, a short little video, 2 or 3 minutes, but it'll be very helpful to help depict what cutaneous wound healing looks like. And here you'll see visually what is primary intention healing and secondary intention healing. Lastly, in this chapter, what are the factors that affect wound healing? So what gets in the way or contributes to poor wound healing or delayed wound healing for some people? So there's a number of factors that I'd like you to read about. One is nutrition. One is oxygen or adequate oxygenation. That is related to blood flow, adequate blood flow. Another factor is impaired immune system or an impaired inflammatory response. And then finally, the presence of infection. Obviously, if there's an infection process going on, that is going to impair or impede wound healing. And then lastly, please read the section on the effects of age. How does age affect our body's ability to heal? In chapter 5, you can skip over a lot in the beginning of chapter 5, get down to differentiation between mitosis and meiosis. Chapter 5 has to do with cell control and cellular function and inheritance. So this is the basis of life and how cells come together to form first embryo, then fetus, etc. But where those first moments of conception are occurring, what happens at the cellular level? A quick review of the X and Y chromosomes, that we have pairs of chromosomes, 1 through 22, and that 23rd pair is actually what determines gender. So compare and contrast cell division via mitosis and meiosis, and those definitions appear in the glossary of this chapter as well. Then moving through the chapter, focus on dominant, recessive, and carrier. And the best way for you to remember this is possibly to come up with examples of dominant traits, recessive traits, and then carrier. Do read about the Human Genome Project, and this is a continual international research project that allows us to actually get to the core of a lot of these just genetic disorders, diagnose them early, and hopefully, we believe, someday be able to prevent some of these genetic disorders. This is a great example of an international community working together with one goal in mind, and that is to be able to sequence the human genome. Chapter 6, genetic and congenital disorders. So there are many, many disorders here that this chapter overviews, but I'm going to ask you to focus on possibly the most common ones that we're likely to run into. If you look at table 6-1, there is a reference to what we call single gene disorders, like Marfan syndrome, von Willebrand disease, which is a coagulation disorder, cystic fibrosis, PKU, sickle cell anemia, and Tay-Sachs. Overview on that table, those genetic disorders that we refer to as single gene disorders. Moving through the chapter, describe inheritance and environmental influences on some of these multifactorial inherited diseases. What is the incidence, pathophysiology, and treatment, for instance, of cleft lip and cleft palate? There is a figure 6-7. Unfortunately, a common enough disorder that we see it in this country as well, and it can be repaired surgically. And then I'd like you to focus on the most common genetic disorder that we continue to see, and that is 1 in 700 births, and that is Down syndrome. Explain how advanced maternal age increases the incidence of Down syndrome, and then think about what the numerical risk is that. Down syndrome is complex. This is more than one genetic effect. There are multi-chromosomal abnormalities that present in Down syndrome. I'd also like you to read about fetal alcohol syndrome. Fetal alcohol syndrome obviously is preventable. And then ending our chapter on a big money chapter as well, chapter 7 has to do with neoplasia, which is cancer. Here we're going to define neoplasm, atrophy, hypertrophy, and hyperplasia. These are terms that have been defined in previous chapters. This is how we actually take those terms and apply them to various cancer disorders. Be able here to differentiate between benign and malignant tumors. There is a table 7-2 which can help you with that. And then the terms cancer in situ, that is INSITU, cancer in situ, versus metastasis. Be clear on those terms. What are the growth properties of cancer cells versus the growth properties of normal cells? I'd like you to read about primary tumor location, and then what is the predictability of metastasis related to the location of that primary tumor. In figure 7-4 and 7-5, there's a good overview of the process of metastatic cancer. I'd also like you to consider these factors: heredity, levels of endogenous hormones, obesity, and immune system function related to the increase in risk for developing certain cancers. What is the probability of hormonal influence on cancers of the reproductive system? What is the possible mechanism related to obesity and certain cancer incidences? How about local and systemic effects on cancer? So these would include, this is what happens to our body as a result of cancer: anemia, cancer anorexia, cachexia syndrome, CACHEXIA, cachexia syndrome, which is like a wasting syndrome, cancer-related fatigue, sleep disturbances. If you look at table 7-3, you'll see an overview of the effects of cancer, local and systemic. Then before we leave this chapter, obviously we have to look at screening. How do we screen for many of these cancers, especially in this country? We screen children, we screen young adults, and we screen older adults for various kinds of cancer. Then as we wrap up this chapter, what are the 3 goals of cancer treatment? So our approaches to cancer are usually either chemotherapy, radiation therapy, or surgery, or a combination of 2 of those, or in some cases a combination of all 3 of those. So I do want you to read about radiation. There's an overview of radiation and the benefits and the harmful effects of radiation treatment of certain cancers. Also look at chemotherapy. Again, there are benefits and there are risks involved with chemotherapy, just like everything we do. What is the goal of hormone and anti-hormone therapy related to the treatment of some cancers? And then describe the goal of targeted therapy. That is it for week 1. I hope that doesn't overwhelm you. I hope between this video related to what I'd like you to focus on and the highlights in the textbook, you're able to prepare yourself for the 10-question quiz at the end of week 2. And knowing that you have no other assignments due week 2, except if you have yet to complete those extra credit assignments. Not that I'm saying you need to get that extra credit, but I do want you to have the experience of completing all of those assignments so that when we get into it, you can hit the ground running and you're not going to be faltering with the mechanics of how those work. I hope you have a great week. If you have any questions, there's lots of people emailing me. Hopefully I'm responding timely enough for you. If you do have any questions, please email me. And I look forward to seeing you in week 3. Thanks.